Hi, and welcome back to another advocacy training session hosted by the Hepatitis Appropriations Partnership. My name is Michaela Jackson, and I am the Prevention Policy Manager for the Hepatitis B Foundation, and we are a part of the Hepatitis Appropriations Partnership Coalition. And today we're going to be talking about making your cause relevant to legislators. So first thing that we want to do is remember that storytelling and really bringing in a presence of somebody who has been impacted by our issue is going to be one of the most compelling and memorable resources that you could have going into these appropriations meetings. And by that, we mean storytelling is essentially real people who have been impacted by viral hepatitis coming in and just simply sharing their story and what they've been through and how it's impacted their lives. And the reason this is so important and why we need to have this story is that legislators and their staff go through many numbers, especially, many health causes have very compelling and important stories to tell. Yours is not the only one that they're hearing from. And numbers can be very, very blurry when you hear number after number after number each day. So you really want to bring in that storytelling element to make it a little bit more real and make it a little bit more personal. Stories and hearing from the people who have been directly impacted can leave a lasting impact on a legislator or on their staff members. So when we have community members telling their story, this really helps to form a connection and ongoing relationships with lawmakers and staff. They want to hear from their community. They want to hear about how their districts and their state has been directly impacted by viral hepatitis. That's what's going to matter the most to them, not just hearing the statistics. Even though this is a nationwide issue, it's going to be incredibly important in order to make this relevant to each and every legislator that you're talking to by bringing in a person from their community and a person from their state. And lastly, we really need storytelling because we don't want to discount the fact that community members are experts within their own right. So they don't need to know the exact science about a disease. They don't need to know every single fact about how a disease works or a virus works in order to be an expert. They know how having a lack of resources has impacted their community and what resources and having resources can do for their community and how it can improve the health outcomes and directly improve what's happening to real people. And that in and of itself is an incredibly important part of the story. When we're talking about numbers, we're also trying to talk about people. People are not just a number, and nobody knows that more than somebody who's been directly impacted by viral hepatitis and a disease. So having those people share their thoughts, share what's good for their community will be really, really powerful and compelling when we're talking to legislators and staff members. And on the screen, we have an example of a storytelling campaign by the Hepatitis B Foundation. Every single person you see on this slide is somebody who has been directly impacted by viral hepatitis and has agreed to share their story. And they're from different states across the US. And just sharing their story also helps build the community up. And it's also a really powerful tool when we're going to talk to these legislators. We can say, we have a storyteller from Hawaii, we have somebody from Washington State, we have somebody from Maryland, and learning more about what they're doing and how people have been impacted is incredibly important and will definitely go a long way when talking to legislators during appropriation season. So now that we understand why it's so important to have storytelling and to make it a part of these appropriations conversations, how do we engage with partners and patients in order to make this effective? How do I make our ask effective? So the first is that we want to identify our allies in each state that we're talking to a legislator from. So this is important because it goes with the phenomenon of a syndemic approach. Viral hepatitis does not live in a bubble by itself. There are several other communities that overlap with viral hepatitis and how it's impacted. And for example, HIV. Hepatitis and HIV are, hepatitis B and C and HIV are spread similarly. They have similar transmission risks as well. And even though they're two different viruses, working together to come to a solution on prevention and preventing transmission, preventing mother-to-child transmission, and working towards treatment outcomes and improving treatment, they have similarities. So we don't want to discount that even though we are working in an adjacent format with some of these diseases, the similarities in bringing us together is going to be powerful. So essentially, we're working together by identifying our allies. We're working together to achieve a better outcome for both groups. And how do we work with these partners who might be adjacent to us and not directly aligned with our exact vision? We want to join their coalitions, and we want to be consistent with joining these groups and showing up. So working together with them does not necessarily mean that we only talk once a year. It means that we listen throughout the year, we understand where their visions are, and we look for overlap of where we can work together and how we can make our asks work as well. So this is key to making our ask relevant and our appropriations asks relevant to legislators, because all of a sudden it's not one community that's impacted, it's 10 communities that are impacted if we're working in tandem together. And that number is quite large when we want to look at it together. So your tiny ask and your tiny community becomes 10 times larger just by working with other people who already overlap with what you're doing. So join the coalitions, be consistent, and talk frequently with the allies and the groups that you're hoping to engage with. Just keep in close communications and really engage with one another. Similarly, when we're having patients, we want to build long-term relationships with them. We don't want to talk to them one time and say, okay, we talked to you, can you now help us, and show up for storytelling when we're going to talk about appropriations to a legislator in your state. You want to build that connection, make sure that they trust you and that they feel comfortable working with you, so that when the time comes to bring in appropriations, when appropriation season comes and you guys are going over to the Hill, that they want to come along, that they want to share their story with the legislators, and that they understand how important it is to have them on board. We want to meet the patients where they are. This makes it as easy as possible for them to work with you. We don't want to make it 10 times harder for them to share their story and 10 times harder for them to come forward. They already have a lot going on. We need to respect that they have their own lives and that advocacy is not going to be the only thing that's going on and not the only thing that's important to them. So meeting them where they are, building that strong foundation of their relationship is going to be really essential to helping patients feel comfortable and help them show up when it's time for appropriations season. And finally, we want to listen to them. As we mentioned before, patients are experts in their own right. They know how this impacts them. They know what they're doing around this disease, and they understand the challenges for viral hepatitis because they're going through it and they're living the reality themselves. So if you guys are talking about what your appropriations asks can cover, and you're saying it checks A, B, and C, this is what this amount of money can do, and a patient says, you know, I don't really think that C might help us, this community in the long term, you want to talk to them about that and say, okay, if it doesn't help you, then what would? You want to make sure that you're working with them and listening to them, because they're the ones who have the powerful stories and they have the expertise in knowing what outcomes are going to be efficient for their communities. And that's going to make it all the more powerful when you're talking to legislators and making your ask relevant. Having that real life experience to back up your numbers and to back up everything that you're talking about, you want to make sure that they're aligned. That's the best way to make your ask relevant to the community members and to the legislators and staffers who are going to be listening to what's going on as well. And that's it. That's the best way to help make your ask relevant to your legislators. You want to make sure that you're bringing in the community, make sure that the community feels comfortable talking about your asks, and you want to make sure that you're engaging with groups that you might not be directly aligned with, but definitely share a similar vision with. And that way you can all work on outcomes to better communities together. So again, my name is Michaela Jackson, and I'm the Prevention Policy Manager with Hepatitis B Foundation. And thank you for listening.